I expect to have a discussion draft on Thursday, and we will go to the bill, obviously, once we get a CBO score, likely next week.
It is high time that we turn the page on this failed Obamacare experiment. The last several elections have helped elect a lot of Republicans, and the people around this country who voted in those elections made it very clear that Obamacare was a major issue in why they voted. And we've been debating this now for 7 years.
Well, we're going to lay out a discussion draft Thursday morning. You'll be able to take a look at it. I think you've heard from some of my colleagues the likely highlights of it. And I wouldn't want to compare it to the House bill. It'll speak for itself. It'll be different and take a different approach based upon these endless discussions we've had with the only people interested in changing the law, which is Republican senators. They've made it clear earlier they were not interested in participating in this. They have no interest in it whatsoever. So it makes no sense.
So are they invited into your planning sessions?
Into the Republican conference? No, but they made it clear they're not interested in helping. They are not interested in what we're trying to achieve at all. We're going to make every effort to pass a bill that dramatically changes the current health care law.
But that's not confidence necessarily. I mean, you wouldn't bring a bill up unless you were confident, right? Did he tell you about the health care bill there?
Yeah. Now, last night, Senate Democrats held the floor well into the night to press Republicans on their plan to pass a health care bill that no one in America has seen without holding a single committee hearing or a robust debate on the floor. In my entire career in politics, I've never heard of a more radical or a more reckless process. The Republicans seem less interested in working across the aisle to address our nation's most pressing issues, more interested in rushing through President Trump's mean health care bill in the dead of night.
I share the concerns of Senator Schumer. I hear these concerns when I talk to people in New Hampshire. It is outrageous that we have 1/6 of our economy being written in secret in a health care bill by 13 men, and that nobody else in the Senate can be part of those deliberations.
I'd ask Leader McConnell one question. He says there's going to be a bill available Thursday. To whom? To us? To the American people? To the nurses and doctors and workers who are in health care, the people who have pre-existing conditions? Who is going to be able to see the bill on Thursday? We don't know the answer. Never sought out negotiations, never sought our opinions, just decided to do this in the dark of night.